Domantas Sabonis played through a torn meniscus, but here's why surgery became unavoidable. Domantas suffered a tear in his left knee meniscus in mid-November in 2025. He originally attempted to rehab the injury without surgery, missing about 27 games before returning, but ultimately underwent season-ending surgery to repair the meniscus in February 2026. Sabonis initially chose rehab over surgery. That meant strengthening, inflammation control, bracing, and workload management to stay on the court. Let's dive a little bit deeper into what a meniscus tear really is. So if we remove the femur and patella, this will give us a good view of the menisci. Inside your knee, we have two C-shaped shock absorbers or crescent-shaped shock absorbers. We have one on the medial side, which is your medial meniscus, seen here, and then we have one on the lateral side, which is your lateral meniscus, seen outside here. Primary role of the meniscus is to help distribute load, stabilize the joint, and protect that cartilage. Bigs like Sabonis take constant contact and rotational stress, which increases that strain on that tissue. So the interesting thing about the meniscus is that there are two parts of the meniscus. One part that does receive blood supply, this being the more outer portion of the menisci, seen here. But the interior or inside portion of the menisci does not receive any blood, or in its avascular zone of the meniscus. That part does not have any blood supply, so healing is very hard to come by. So how does a meniscus injury happen? So meniscus tears typically happen with a twisting motion on a planted foot, kind of seen right here. It's very common in basketball or for basketball players. You have to be thinking about pivoting in the post, absorbing contact, or a sudden change in direction. That femur rotates over the tibia and the cartilage gets pinched, kind of seen here. There's a variety of different types of tears that can happen at the meniscus. It's really depending upon how the tear is formed, the kind of style or look of the tear and whereabouts it is. Some types include like a bucket handle tear, seen here, more of a horizontal tear, seen right here, a peripheral tear, seen right over here, as well as a radial tear, which is the most common, seen right here. Some tears, especially small or stable ones, can be managed without surgery. So if symptoms are tolerable and the knee isn't locking or giving out, athletes sometimes can push through. But if swelling, mechanical catching, or persistent pain can mean that the tear isn't calming down, and surgery might be the best option for longevity purposes. So in order to fix surgically a meniscus tear, when rehab is not enough, surgery is then the most appropriate option. The two main options include your meniscus repair, which is typically just stitching it back together, or that partial meniscectomy, which is that trimming that damaged tissue. This video is describing that meniscus repair, which is that stitching it back together. This is typically a longer recovery timeline, typically taking about 3 to 5 months. However, that partial meniscectomy will typically take about 4 to 8 weeks. So the reason why someone would choose to do a meniscus repair over a meniscectomy is to preserve that native tissue, which significantly reduces the risk of long-term osteoarthritis when that becomes more bone on bone at that knee joint. It also helps with improving that knee function, as well as enables a faster return to high-level activities, especially important for Domantas Sabonis. While a meniscectomy, which is that removal, provides faster and short-term recovery, it does cause over 50% of patients develop a arthritis due to the loss of that shock absorption, which is super important for that meniscus. So NBA players often return a lot faster than these recovery timelines due to the elite rehab that they do receive. Sabonis tried to play through it, but long-term knee health always will win. And it's very important for the medical team to note this, as even though they want him to be able to play, it is important that he does keep himself healthy for the long term. Unfortunately, that is the balance between competing now and protecting your career. Hope you guys enjoyed this video though. Let me know if you have any questions down below, and thank you so much for watching.